My name is Commissioner Frank Avila. I'm a commissioner at the Metropolitan Water Reclamation District of Greater Chicago. And the name of our show today is Vaccine. Yes or no, or should we put it good, bad, or ugly? But we use yes or no. And as my guest, I have Dan Boyle. Dan Boyle is a licensed clinical social worker with 30 years experience as a medical social worker. In 2009, Dan experienced a severe reaction to the flu vaccine, and he was required to take it for his job as a healthcare worker. And he's going to explain to you what happened to him when he got his flu shot. Also, in October of 2013 of this year, Dan presented a summary of his experience at a medical conference in Padua, Italy. And Dan, glad to be on our show.
Thank you very much, Frank. Thanks for inviting me.
And I mentioned the name of our show is Vaccine.
Right.
Yes or no, or should we say good, bad, or ugly?
Yes.
Okay, and
all three in a way for me.
all three in a way for you?
Well, this happened in December of 2009, and there was a lot of pressure put on healthcare workers then because it was the season with the H1N1 flu.
Yes.
And they wanted to get as many people vaccinated against that flu and the seasonal flu that year also. So there's a lot of pressure put on healthcare workers throughout the country, really. And so when I went and I got the vaccines at the employee health office, I had to talk myself into it because I'd worked in hospitals many years and hadn't usually gotten a vaccine. But I said, you know, my dad died of polio, and vaccines are good, you know, so I'll get them. And 12 hours later, I was lying in bed and I had severe pain in both shoulders, and I didn't really know what was happening. And it took quite a while to figure out what was going on and get the proper treatment and help for myself. So this experience has led me to research more for myself and to try to understand really what is the best approach. You know, vaccines are good. They're used to prevent polio, TB, all kinds of things. So measles, mumps, childhood illnesses. So I have to say, I believe in vaccines, but because of the experience I've had, I think we need to make them safer, and we need to find ways to get to the people that have been injured and help them.
Vaccine. Now, how did you find out what your diagnosis was? I mean, you said that you had the flu shot, you went home,
right?
And after 12 hours, I mean, you were gone.
Yeah, I could sleep for maybe 90 minutes at a time, then I'd wake up and I had just tremendous pain in both shoulders. And I don't remember if I went to work the next day or not. I'd learned about pain, that you can distract yourself sometimes, and that's a good way to handle it. But 2 days later, I went to my chiropractor that I'd seen off and on for low back pain over the years, and he could see that my muscles were contracting in ways that weren't normal, and he tried to, you know, stretch them out and help me as best he could. And then 2 days after that, I went to one of my primary care doctors, to their office on a Saturday, and they took an x-ray and they thought maybe it's arthritis. They weren't quite sure. Meanwhile, when I couldn't sleep, I'd be on the internet, and I'd been trained in public health, and so I knew to go to the PubMed. It's the National Library of Medicine, and you can research all of the medical journals and articles. And so I was searching, and I did find an article by a doctor that talked about shoulder dysfunction after flu vaccine.
Oh.
And it was a Sunday morning, and I emailed him because his email was in the abstract in the PubMed site that I saw. And I sent it out on a Sunday morning and told him what had happened, and I wasn't sure if I'd ever hear a reply. And I came home later in the afternoon, I checked my email, and I got a reply from this doctor. He happened to be practicing in Napa, California. He said, "I'm not sure what you have, but I know a doctor in Chicago that I think could help you," and he referred me to the Rehab Institute of Chicago. And the next morning, Monday, I called them, and by Wednesday, that was 2 weeks after the flu shots, I had an appointment with a doctor who knew what it was.
I see. Now, you mentioned you got the flu shot, not because you wanted to get the flu shot, that you were working for an organization, maybe a hospital,
Yes.
that I wouldn't say, well, I could say forced, mandated all the employees, if you want to work here, you have to get a flu shot.
Well, since 2009, I've seen that it's become more regular for hospitals to require all their employees to get them. Now, they leave some exemptions. Sometimes it's a religious exemption. Sometimes they'll say if you have a note from your doctor or a contraindication, you don't have to get it. But otherwise, you have to be vaccinated. And I appreciate that they have some exemptions, but if I'd gone to my doctor that year and said, "Write me a note so I don't have to get these," she would have talked me into getting them right then and there in her office.
Oh, your doctor too?
Yeah, because they say, well, you don't want to give anybody to the flu, you don't want to pass it on, and this type of thing. So my point about giving, especially healthcare workers, but really anyone, full informed consent, let them make the choice, and to not go to the mandates and the coercion. It's using a lot of force, people's livelihoods, their jobs, forcing them to accept a medical procedure that does carry some risks. They're small, but they're real. And so I agreed at the time. I had no idea that my body would react in this way to the vaccine. And that year, it was kind of unique because they had the regular seasonal flu shot, and I got that in one shoulder, excuse me, and then I had the H1N1 in the other shoulder. So there's confusion now, well, which one caused it, and was it a combination, or, so it raised a lot of questions that I'm still searching the answers.
Oh, it's still from 2009.
Yes.
You know, it's strange, you mentioned that the flu shot in 2009, was that a bad batch, or did you ever find out it was a bad batch, or?
No.
No.
There's a system in the United States called the Vaccine Adverse Event Reporting System.
Yes.
And it's the Food and Drug Administration and the Centers for Disease Control and Prevention developed this site, and doctors are encouraged to report, or any individual can go there and report on their website an adverse reaction or a side effect. You don't even have to know if it was caused by the vaccine, but if it was close enough, you just put in the report.
Yeah, you know, you mentioned that you had a flu shot in 2009, and that you symptoms were your shoulders, and this, you went on the email, and
Yes.
the doctor said to go to see this doctor at the rehab.
That's right.
Now, why was it difficult to receive a diagnosis here?
Well,
And appropriate, what kind of treatment did you get too, also?
well, the difficulty is that this condition is somewhat rare. One of the articles I said it's rare but not uncommon,
Rare,
which
but not,
was
yeah.
kind of confusing in itself. So it's a known condition. It's associated with some vaccines, tetanus vaccines, other vaccines, but doctors don't see it that often. And sometimes it can be mistaken for a shoulder injury, a rotator cuff, or arthritis, and this type of thing. And it's kind of minimized. So I did report this to the Vaccine Adverse Event Reporting System, and they track by lot number and other things, and they try to determine if there's some systemic problem out there with a batch of vaccines or a particular vaccine. The interesting thing was, in 2009, they didn't really say this caused this kind of problem. There weren't enough of us identified in it for them to zero in and say, oh, we need to look for this. We need to understand why it's causing this. So the numbers aren't there for them to kind of bump it up to a closer look at the vaccines.
When back in 1973, I was about 35 years old, and I had a flu shot. And I don't know, I had Bell palsy, and I don't know if the flu shot was the cause of it or not. And it paralyzed my whole left face, my eyes. I couldn't close my eyes. I had to wear a patch on the eye. My mouth, I couldn't, the muscles weren't there anymore in my mouth, and so I couldn't drink water, and had to go to work. And I was working in near Bloomington, and so I had to go to work with a patch on my eye. I had to drink with a straw, and I went to the doctor, and my medical doctor, my primary doctor, didn't know what was wrong. My wife suggested, well, go to the University of Illinois Research Department. I went there, and they couldn't find anything. They said it's probably Bell palsy. But I don't know what was the cause of it, and I don't know if it was a flu shot or not, but till this day, from 1973 to 2013, I haven't taken a flu shot, and I haven't had a flu.
Well, one of the reasons I'm speaking out more about this is because I think things like that do happen, and the medical profession wants people to get vaccinated, and when they hear that someone might be injured, well, there's kind of a reluctance to really, or there's just kind of a silence about it. And I think we could do more to really study these and to find the people that have had any kind of negative effects and talk with them. This adverse event reporting system is a one-way street. You tell them about it, they go off and they kind of do their computer analysis, but they don't really find out from the individual or study the individual or many individuals and find out, well, how did their immune system respond in this way? One doctor that I found also on the internet responded, and she studied this condition. It's called neuralgic amyotrophy, where my brachial plexus was affected by my own immune system. And it's an autoimmune disease or something like that. Well, this needs to be studied a little bit more and go into how does the flu vaccine cause some people's immune system to respond in this way. So there's a lot more that needs to be done and could be done to study those that have been affected and help them find appropriate treatment.
And this happened in 2009. We had a study session. I'm the commissioner at the Metropolitan Water Reclamation District, and we had a study when that first came out about if people should take that flu shot. It came out of what, the birds, or I forgot.
There was avian flu and SARS, and that's right. There's been a lot of scares,
and so
worldwide.
They were saying, should we take that flu shot or not? So we brought in a research person from the University of Illinois, and we had a study session. And in his topic, what he was telling, when he was talking, he mentioned that at the time that I took my flu shot, it was a bad batch. But no one knew at that time, and I didn't know. All these years I didn't know.
That's right.
Until our study session.
Well, one of the things that came to me in those first weeks was how much we don't know. I was online and I was searching every medical journal I could find through this PubMed, and I could find a study at the Mayo Clinic where they took somebody's brachial plexus and put some lymphocytes in there, and sure enough, the lymphocytes ate one of the person that had been affected by this, and the other it didn't. But that was one study in 20 years. There's just very little that's been explored about this.
So since your employer asked you to take the flu shot, I mean, they didn't force you, right? They just asked you to take the flu shot.
Right, the managers were encouraged to have everybody do it. Right. There was a threat that you'd have to wear a surgical mask for 4 or 5 months while you were at work, which was kind of, an obstacle for some people.
Now was your, I would call this an injury.
Yes.
Was this covered through workman comp? Does workman comp
Well,
cover
that
this?
was another kind of challenging part of this, that I made a regular claim for the workers' comp, and initially they gave me some pay for some of the days off that I would have normally had to take sick days. But then, after submitting all of my doctor's records, including the doctor that diagnosed me, they came back with a one-sentence letter saying, we did not find this caused by the flu shot, and so we're not going to. And what I found, talking to different attorneys, it's a very adversarial system, and I decided not to add more insult to injury, and I just used insurance and benefits that way to take care of the medical treatment.
Now, are you sure that it was a flu shot? I mean, did the doctor that you went to say,
well,
yes, Dan, this is a flu shot? You know,
I actually, he said, first of all, he did a thorough exam.
Yeah.
We had a resident with him, and he was behind me, and they said he's winging. His scapula is sticking out more than it should be. He said that, and the other weakness that they found, and the close association with the flu shot made him believe that that's what it was. Also, I found a doctor that had studied this condition. The doctor at the Rehab Institute, when I left his office, he patted me on the shoulder and said, read up on it. So I did. I found a doctor in the Netherlands who studied this condition more than any doctor I could find.
Yeah.
And she says, my immune system made an error. Yes, vaccines can do this. But the immune system made an error and reacted to it in a way that was more than my immune system needed to. And for whatever reasons, we just don't know.
Yes. So probably your immune system, you know, these receptacles where our hormones in our body, the receptacles opens up, the hormones go in, and maybe your flu shot, they thought it was a hormone, and it went into one of these receptacles
The
in your
immune
body.
system is a beautiful thing that we have. And vaccines are very important in a way. They're kind of a treasure of how we can prevent so many serious illnesses, infectious diseases particularly, through vaccines. So but we're dealing with the human immune system, and what I find is the doctors don't know much about it. I would say, well, I had this big rash also, and I'd get just kind of nodding. Oh, well, what about, I had a flu-like illness 5 weeks after that originally occurred, as if I had the flu. Well, maybe you've got a strain of a cold. I don't get colds. So there was not much appreciation for how the immune system is so important and how it can react.
Now, you mentioned you weren't covered by workers' compensation. Are there other programs that compensate people who are injured by vaccine?
Well, again, almost inadvertently on the web, I found the Vaccine Injury Compensation Program, which is a federal program. For every flu vaccine dose that's sold, I think 75 cents goes into this fund.
Oh.
And if you can prove, and usually you'll need an attorney, the website for this is available, I think, through Health and Human Services.
Yeah, we have the web. I think you gave us the website, right?
Yes.
6 of those websites.
Yes, and you really should consult an attorney, and they have a list of attorneys on this website that are specialized in the claims court, the federal claims court. So it's very complicated, and you can make a claim yourself, but I would encourage anyone that thinks they've been injured to get an attorney who specializes in this.
Yeah, you gave us about 4 or 5 different websites, right?
Yes, the VAERS, the Vaccine Adverse Event Reporting System.
So that's the website. Maybe we could bring it on.
If someone thinks they've been injured, they can do it. If their doctor knows about it, the doctor can do it. If the doctor doesn't mention it, you can do this yourself. It's vaers.hhs.gov.
And so this website, if you, what again now?
You report what you think is a side effect.
Oh, okay.
You could just have a bad cold for 3 days, and you can make a report on this.
Oh, so the doctor doesn't do it, or
doctors are encouraged to do it.
But maybe
anyone can.
Oh, anyone could. Okay.
Anyone can, and they look at them, and they go from severe to just runny nose for a few days, or a red spot where they gave you the shot, to convulsions, severe pain. They get some reports of serious injury or death. It doesn't mean they were all caused by the vaccine,
Sure.
but it gives them all this data to study and find out how to improve the safety of the vaccines.
Yeah, you gave us several websites, right? So
Yes, so that's the Vaccine Adverse Event Reporting System. The other one then is the Vaccine Injury Compensation Program.
Vaccine
Injury Compensation Program. That's coordinated by the federal government also, and it's for any vaccine. Childhood vaccines, tetanus, flu, it doesn't have to be the flu vaccines, for any vaccine.
And that's the website that you gave us there.
Yes.
Okay.
If you would Google or search for vicp.gov or VICP, you'll find the Vaccine Injury Compensation Program.
Interesting. You know, I never knew about that. But you know, the problem is that how would you get compensated if you here's on the screen right now?
Yes.
How would you prove it, or how would they accept it? You mentioned your lawyer mentioned that if you appeal, they.
Well, I had to find out myself, really. I had to find out these things almost by accident.
Yeah.
And in fact, I didn't think I was eligible for this program because that's for the normal vaccines. In 2009, the H1N1 vaccine was covered by a different program called the Countermeasures Program.
The Countermeasure Program?
And if there's a public health emergency, which they declared that year for the H1N1, you had to go through a separate program. And so I really didn't know until last year that I was eligible for that program. And it's still being discussed.
Yeah, I think a lot of people, including myself, wouldn't even know of these programs existed or where to go to find out about it, because I didn't do any research. I just accepted it.
Yes. There's a certain trust that we place in national institutions and the medical field around these things, and that's why I really appreciate you inviting me to educate people that these events do happen. There's help available for people.
Yes.
There's resources. They have to really sometimes look like you did. You went to a research hospital to try to get an expert opinion on it. But nowadays, with the internet, it's a little bit easier, but still it can be very challenging, especially when you're dealing with a serious injury.
Now, you mentioned that because of all this, what happened to you and all this research, and you went to Italy, right,
Yes.
to present your.
Yes.
How was that going to Italy?
I found that there was an organization there interested in person-centered medicine, and I took the position that, we need to apply person-centered care to max vaccinations. So we have to treat each person that gets the vaccine as a person and follow up on them. Fine, you had the shot, but a week later, are you okay?
Yeah.
Or, they're glad to sell you the vaccine at the local pharmacy, but what happens if you have an adverse reaction? Will there be anybody there that can help you and figure out what to do about it?
Now, you started a blog, right?
I started a blog.
What's the name of your blog?
The blog is called Vaccine Injury Support.
Vaccine Injury Support.
Weebly.com. Weebly. It's a sort of a public access kind of website.
And how long has that blog been up now?
A few days.
Here, we're the first one advertising.
A scoop.
A scoop, yes. And so any person could go on that blog for your information?
For my information, and if they want to comment, because I really do want to help other people that might be struggling with this. There's, on the one hand, you see some websites and that vaccines are the worst things ever and don't go near them. And on other ones, you're seeing, well, we have to, give them to everybody whether they want them or not. And I think there needs to be more thought and analysis and research really given to how to improve them and how to make them safer.
Yes, I know that there's a lot of discussion. There's a group of parents out there that not only on flu shots, but when their
Sure.
baby is born, when they should take these shots or when not should they take it. And so it's a big issue, and because people are getting more this internet, they could do a lot of research.
I went on the VAERS site, the Vaccine Adverse Reporting System site, and I found my report. It's a 36,000 row spreadsheet that you can get on that website. And you can see all the people that made a report about a vaccine that year. I found mine, and it didn't take me long, a couple hundred, maybe 1,000, and I found people with severe shoulder pain, weakness, weeks after their shot. Now, they're telling the system this happened, but there's no response back and say, get to this doctor or try this medical center, maybe they can help. I think there needs to be a national center for vaccine injury.
Yes.
To focus the information and get it to the people that need it.
You know, you're right, because we're living in 2013. World War II ended. They brought back DDT back from the war, and they were going to use it for commercialized purposes. They found out that it was toxic to the public. So maybe some of the ingredients in the DDT they're making other products from the toxic chemicals, because they banned DDT, but yet some of the ingredients in there they didn't ban, so they're making other products. So through the years, maybe a lot of these personal care products have ingredients in there that when you take that personal care product, you take the flu shot, it meets in your body, and then your body breaks down.
Well, I'm starting to think of our immune system is a treasure. It's kind of a global resource. And vaccines are global resources. They're used around the world, and they're needed. But we really need to know more about how they work, how to make them more specific, more effective. You know, when you get the flu shot, maximum in a year, maybe 70% of the people get immunity to the flu that year from the flu shot. 30% go around thinking, I got the shot. Now, I'm not saying that's a bad thing. I'm saying that's the reality. But we don't think that. We don't hear that when we see the advertisements for get the flu shot.
Free flu shot.
Yeah, we think, oh, that's great, that's going to take care of it. It doesn't. Yeah. We need to really learn more and study it and get the information out there.
So is vaccine good, bad, or ugly? Vaccine, yes or no? And that's why we brought Daniel on board to show his blog.
Thanks.
His new blog, 2 Days.
Thanks very much, Frank, and for your interest in this important topic.